According to the Maine Attorney General's office, more than 400 Mainers died of a drug overdose in 2017. That is the highest amount ever. Now, local and state leaders are looking at some new ways to save lives. They're called safe injection sites, a place where people can use illegal drugs under medical supervision. There aren't any here in the U.S., so we sent our Jennifer Long to Montreal, Canada, to see how the sites there are working.
Montreal has 4 safe injection sites. Cactus is one of them. It opened less than a year ago, but it's already supervised thousands of safe injections here, and not one person has died while using.
Tucked away on quiet Berger Street in downtown, Cactus Montreal is far from quiet when open.
Now that we can offer a safe and welcoming place for people to inject themselves, well, we feel that we're finally doing the right thing.
Sandhya Vadlamudi is the executive director of the site. She says about 100 people come here every day to inject illegal drugs.
So this is the safe injection room?
Yes.
The facility provides everything a person would need free of charge.
Somebody comes in, takes a basket and fill with the equipment that that person wants. These are needles. This is just water and a cup so they can heat the drug.
Users bring their own drugs and inject themselves.
When the person does their injection, there are always staff in the room here. So if the face changes, if there's a change in their face, somebody can rapidly identify and offer support.
Vadlamudi says no one has ever died of an overdose here or any other safe injection site in Canada.
The Canadian government is convinced.
Dr. Carol Morissette is with Montreal Public Health and says the sites operate legally with an exemption from the federal drug law. But she says it took a while to get here.
During the last 10 years, we observe a lot of change in the Canadian perspective on supervised injection services.
Insight, Canada's first safe injection site, opened in 2003 in Vancouver. It faced severe criticism and skepticism from the Canadian people and the government. 2 users preemptively sued to keep the site open after the government appeared it would keep the facility from being able to operate. In 2011, the Supreme Court ruled in favor of the users and the site.
So it's well documented and well evaluated, the impact in the community. Less syringes, that is in parks, in public, area. Less injection in publics too.
There are now 25 sites operating across the country, but despite implementing the sites, Canada continues to see a rise in overdose deaths.
The situation of opioid death and overdoses in Montreal and Quebec is far less intense than what we observe in the rest of Canada.
According to data from the coroner's office, the number of overdose deaths are increasing in Quebec. Since June of last year, more than 100 people have died due to overdose in Montreal, an average of 11 deaths a month, up from 6 deaths a month in previous years. Maine's numbers are much higher than Montreal's, with the Attorney General reporting more than 400 overdose deaths in 2017. Dr. Morissette says safe injection sites would be worth a try, but warns they require collaboration on many levels.
I think that to be able to implement that kind of services in a state, you need to have the collaboration of all the stakeholders that are involved, including health authorities, public security authorities, probably a change in the regulation of, or the law.
Even with more sites set to open in Canada, Vadlamudi sees no sign of things slowing down at Cactus.
We do have times where the booths are all in use.
As the conversation about safe injection sites just begins to pick up speed across the border in Maine. Reporting in Montreal, Canada, Jennifer Long, CBS 13 News.